Hi everyone, my name is Dr. Ganesh Veerabhadraiah. I am a consultant neurosurgeon in FortisHospital CunninghamRoad, Bengaluru. Today, June 8th, World Brain Tumor Awareness Day. In this day, we'll know some facts which one should be aware of brain tumor. A brain tumor is an abnormal cell growth or mass in brain. Some are benign, non-cancerous, while others are cancerous, malignant, and can start in the brain as a primary brain tumor or elsewhere in the body, which will move into the brain called metastatic brain tumor. The rate at which brain tumor develops varies substantially. The pace of growth of brain tumor as well as its location defines how it influences the function of your neurological system. Every year on June 8th, World Brain Tumor Day is commemorated globally to raise awareness and educate people about brain tumors. In India, the rate of central nervous system cancers varies between 5 to 10 per 1 lakh people, with increasing trend and accounts for 2% of malignancies. Common brain tumors are 1. Non-cancerous. These are meningiomas, acoustic schwannomas, pituitary adenomas, and others. Common cancerous brain tumors are glioblastoma, anaplastic astrocytoma, gliosarcoma, and lymphomas. Symptoms. The indications and symptoms of brain tumor differ widely depending upon size, location, and pace of development of tumors. Let us know what are all the symptoms can happen in brain tumors. Prolonged severe headaches, unexplained nausea, vomiting, especially early morning headaches, which intense headache followed by vomiting, and vomiting relieving the pain is a classical symptom of brain tumor headache. Other symptoms are blurring, double vision, loss of peripheral vision, etc., and loss of field of vision, loss of feeling or immobility to and inability to move the hand or leg, challenges maintaining equilibrium, balancing problems, speech difficulties, and always feeling exhausted, personality or conduct transformations, seizures, hearing issues. All these are some of the common symptoms to have brain tumor. What are the causes of brain tumor? Primary brain cancer's precise etiology is unclear. However, studies have found a relationship between high dose of ionizing radiation and increased risk of brain tumors. Medical imaging tests such as CT scan, X-rays, radiation therapy treatment, and probable work exposure are most prevalent sources of ionizing radiation. Other variables that may contribute to the development of brain cancers include increasing age, family history of brain cancer, chronic history of smoking, insecticides, herbicides, fertilizer exposure, working with cancer-causing substances such as lead, plastic, rubber, petroleum, certain fabrics, and having mononucleosis or Epstein-Barr virus infection, which predisposes to lymphomas. And cancer that starts in the other part of the body can travel into the brain, also known as secondaries or metastatic brain tumors, develop when cancer metastasizes from other part of the body into the brain. and its initial evidence of cancer with a history of cancers are more likely to develop secondary brain tumors. Diagnosing techniques are CT scan to screen the brain, MRI scan to know exact location or spread and precise anatomy of the tumor and surrounding brain. MR spectroscopy to understand the nature. Example, brain tumors will have choline peak, which is seen in the graph. PET scan, positron emission tomography, it is to know the secondaries. And angiogram to see the brain vessels, and biopsy. And others are tumor markers in the blood, urine or tissue. And one more much advanced which is still in the experimental stage are ctDNA, circulating DNA detection in the early stage. This ctDNA will be released, the fragments of DNA will be released into the circulation once cancer cells dies, and once we detect this kind of ctDNA, it will be easy to detect the cancer cells in the early stage. Coming to treatment options of brain tumor. Surgery. It is a primary mode or initial line to remove the tumor, and it's ease the neurological symptoms if there are any, and offering the tissue diagnosis, genetic study in aiding the effectiveness of various brain tumor therapies in many cases improves the person's prognosis if it is remove the tumor early and reduce the mass of tissue in the brain. Radiation therapy. The high energy X-rays or other particles to eliminate the tumor cells can be used to delay or stop the tumor growth. Stereotactic radiosurgery, LINAC surgery, cobalt-60, all these are common radiation therapies used. Medication-based therapies are used to kill the cells and eliminate the circulating cells and can be administered into the patient directly. Or chemotherapy. Chemotherapy used, it is useful to kill the tumor cells by preventing them to grow and dividing them and producing new ones. All this can be prevented. Consists of defined number of cells are administered over a certain length of time in a single dose or mixture of drugs at the same time. Targeted therapy, targeted chemotherapy. In addition to the traditional chemotherapy, target the tumor specific genes or proteins or tissue environment that contribute to the tumor's development and survival is known as targeted therapy. Immunotherapy, bisphosphonates are also used. And radio frequency tumor treating fields to treat the glioblastomas by sending mild electrical fields that disrupts the cancer cells' ability to grow and divide. Other treatments are proton therapy and particle therapy. The advanced tumor surgery make it is safer, or advanced tumor surgery make our surgery safe, or these are the additional tools where we use to ease the brain surgery. CUSA, Cavitron ultrasonic surgical aspirator. Neuro navigation. It makes the surgery minimally invasive. Awake craniotomy to resect the tumors accurately. Interventional MRI, real-time surgery. Neuroendoscope, preoperative embolization, endovascular treatment to minimize the bleeding, and stereotaxy. All these are tools which can make the surgery much easier and safe. Thank you for watching this video of brain tumor awareness. If any questions, you can write to us, you can contact us. For more information, please stay tuned. Thank you. Namaste.